I think people don't realize how good the biotech ecosystem in Belgium is. I didn't fully appreciate it before I got here either. I don't think we're very good at communicating that to the outside world. So it's really how much this contributes to the Belgian economy and prosperity and stuff like that. We have a unique amount of ingredients of having excellent science and then having these many companies. There's a lot of companies from outside that also get attracted to the ecosystem here, and then it creates jobs. It's just all around quite a remarkable environment to be in.
Welcome to Called to Science, where we uncover the untold stories of the people pushing the boundaries of the life sciences. I'm your host, science journalist Brad Van Peerdonk. Today's episode is about crossing bridges, but not the kind over rivers, rather the kind that takes science from the lab bench into the real world where it benefits and changes lives. Welcome, Jiska van der Reest. Your career and academic journey began in your home country of the Netherlands, and you've made stops in Glasgow, at the Cancer Research UK Scotland Centre, and then all the way to Boston, where you studied at the famous Harvard Medical School. Your research focused on cancer metabolism, but along with geographical changes, you've navigated a voyage from the lab bench to the world of business, and are now a business development manager at VIB. To me, this path is perhaps unconventional, or at least not as well explored as those ventured by others who have been called to science. But it is a great example of the breadth of scientific careers available and the importance of multidisciplined individuals in translating scientific knowledge into tangible benefits for society. Welcome. Thanks for being here.
Thanks for having me.
So we'll start with something that I was reading in the notes that were given to me. You grew up in the Netherlands, and at one point you might have thought about being an architect in an alternate life had it not been for all the math involved. This is exactly how I feel about physics. I love the ideas, but I hate the calculations. What
fair.
is it about architecture that draws you in?
I think recently read this quote that says architecture is like frozen music. And I feel like that's a really beautiful way of putting it. I also think there's something about the symmetry in buildings that I really like, different materials. So there's just always something I love nature too, but going to a city and just watching the buildings for some reason, it fascinates me.
Interesting. So if you could choose, to live anywhere, it would be like you're like a city person?
I think to live, yes. I love nature, but I want to do things. So I would say I'm a city girl, yeah.
And then something about this idea, I love that quote too, like frozen music, because there's something creative, obviously, about architecture. It's not engineering, where it's, again, all the math. It's about the outward expression, the beauty of it.
But I think engineering can be beautiful too. If you look at these massive bridges, for example, I think there's a beauty there too.
Well, speaking of bridges, you've constructed a career that bridges the worlds of science and business. But before we get there, how did you end up studying science? Is it something that you were interested in at an early age or that came later?
I feel like I didn't necessarily have such a come to Jesus moment to become a scientist. I just followed the courses, and you notice what you're good at, what you're not good at. And I noticed at some point during my bachelor's degree, I guess, that most of the people that were really into the certain subjects, they would go on to do a PhD. And I also felt like I wasn't necessarily so happy to go out and start a real job yet. So I think having this break of being able to learn more, I wasn't done learning. Of course, you still learning your career as well. So maybe that was a misconception at the time, but it just seemed really cool to have this period of 4 years to really focus on a deep research project and just further develop yourself.
Is that something that you found throughout your whole career, is just this idea of being open to the doors that present themselves more or less, rather than being so focused on one sort of end goal?
I feel like I was actually super focused. I think also during my PhD, there would not be a week or two that would go by when I'm thinking about the next step and what do I want next. And I was super focused on that. But then for some reason, I ended always up somewhere that I didn't choose to be. I didn't necessarily wanted to do my PhD in Glasgow. I was doing an internship there. And I thought that afterwards I would return, and I already had seen a lab that I wanted to do my PhD in. But then when I arrived there for the internship, it was a whole other level of science that they did there. And I didn't want to leave anymore, so I stayed. But I never figured that I would be living in Glasgow for 5 years. And then I was very adamant that I never wanted to go to the US specifically. But then it turned out that in my field of science, a lot of the big labs were just located there. So that means that the meetings are taking place there and, the collaborations are happening there. So I just had to follow kind of the field. And that's how I ended up in Boston, which wasn't really a particular choice that I always wanted to make. I think just follow opportunity, I guess.
You've had this, let's say, unconventional path from the lab to the world of business. But what did you study in your PhD? It was cancer metabolism, and maybe you just give us that journey and when it switched for you into thinking about business, when you were introduced to that sort of idea.
I think I never was particularly interested in business. I think the last business class that I took was maybe in my early bachelor's, so I did not foresee this path at all. But I was always active in all sorts of other things, like student advocacy, organizations, all sorts of activities, whether it was teaching, being a representative for, fighting for better rights for the students in the university. I always did these things. And I think as I grew towards my PhD, you have a lot more access to different programs. So I did things with United Nations or consulting programs, like summer schools or courses on biotech. I did literally everything just to figure out whether I liked doing it. I did science writing, science communication. And for some of the things, then I realized like this is not really for me. But I think the PhD is a time where you need to explore that and really not focus on just doing your lab work. You will never have access to these opportunities again. Often you have to be a student. And I was able to go to Switzerland, to Singapore, to China, the Philippines, all these different programs that I never had to pay anything for. You apply to these programs and then it's fully funded. And it just allowed me to see so much more of the world and different things to try. Then I think once I was in Boston, I did do a mini MBA program there at the Harvard Business School. But then I also realized an MBA wasn't for me. So I think just all these bits and pieces that allows me to do the job that I do now, because you need to have a very breadth of different expertise that allow you to make a success with these programs. So I would say people should just really explore and make use of figuring out what it is exactly that you like to do, because before you try it, you don't really know.
Mm-hmm. So you're doing the PhD and you're doing sort of real basic research lab, fundamental research. Did you then kind of already know that maybe that wasn't where you wanted to stay, or trying all these new things was, well, I like research, I could stay there, but why not try these other things?
I think I was fully convinced I was going to be a professor when still going for my postdoc, because I think otherwise I wouldn't have gone for the postdoc. But I just always have a wide interest in different things. If I see things around me in the system that I don't think are acting right, then I'll form a committee and, go to leadership and try to change it. That's just something. Yeah. And so you end up in all these different areas. And I think even if you are laser focused on science, you need a lot of different skills. You need the people skills. You need to understand, clinicians that have a very different, they have a different goal, but you need to collaborate with them. So you need to understand what is success for them in order to have a good collaboration. So I think in the end, that all contributes to the same. And I think working in cancer, I think there's a little bit more of a focus on translation anyway, because in the end, of course, everyone knows that we want to improve things for patients. So it's a little bit less fundamental in that aspect, that even if you go to the most fundamental scientific pathways and approaches, in the end, you are expected to take a step back and think, how can we now apply that to make a difference for patients? Right.
Yeah. It maybe has a bit more focus in that area than other research areas. Hearing you speak about these different opportunities that you jumped on, that you were presented, but also just hinting at your motivation there. If you see something that's not right, you want to form a committee, so you had some of these projects. I'm curious then, how does that end up in the business world and not say like politics or, nonprofit. It's something that maybe from the outside, I'm not seeing the connection.
Yeah.
So how do you, how did that work?
No, this makes a lot of sense. It's a good question. But I think I started out actually in the nonprofit social innovation sphere. So a lot of these programs are focused on social innovation. So they bring together scientists and people of all disciplines. They give you a set of problems that exist in the world. And then we try to put our expertise together to come to solutions. And we actually try to get one of these projects started and run in the Philippines. But a lot of the NGO type solutions are not sustainable because in the end it relies on money coming in to create something, but it's not self-sustainable. And that's where social innovation tries to create businesses that can then, create a business model around solving such a problem so that it actually self-sustains itself, because that is essentially what's going to help the community. And charity work is also important, has a role. But it would be better if it would be self-sustainable because then it can go on and on. So that's why I started focusing on entrepreneurship and business. But I feel like it's very similar here at VIB because we are a nonprofit. We have a mission of creating social impact for patients, for society, for the planet. And we're trying to turn that science into these solutions. But we do need a business and financial aspect to it. Otherwise, again, that's not going to be self-sustainable. So I feel like there are some connections there. I hope they're a bit more clear to see now.
Yeah, no, absolutely. That makes sense. Maybe I'll get you to expand too then on that link bit of science and that sort of business world in this sort of tract as you see it. Do you see it purely as, again, this pursuit of we can make things better? How do we do that? How do we make it sustainable?
I think it's simply necessary because money is not endless. So if you think about drug development, that's hundreds of millions that, need to go into development of new therapies. Would it be ideal if that was not in the hands of capitalism? I think yes. But do we have an alternative of trying to find that funding without, in the end, having the businesses also make a profit to then reinvest back into developing the new product? I don't think we have a different solution now. And it doesn't seem feasible to have drug development, for example, be in the hands of government, for example. So we need businesses. We need to have innovative startups. We need to collaborate with the pharma and biotech industry, also because they have a lot of skills. Like, it's not just science that will get you there. Product development is a very technical process. In the end, you need to also think about marketing, distribution, and just producing the entity that is the drug. Those are all things that we cannot do in academia. We really need expert people that are able to deliver that. And there we see that the big pharma companies and biotech companies, they are able to take it all the way. And we simply can't do that. So there I think it's a symbiotic relationship.
And now we have a little segment called Dare to Ask, where we take questions submitted by the VIB community that they may have wanted to ask you, but never dared to ask. Are you ready?
Mm-hmm.
Do you ever miss pure science?
No.
No.
I feel like I do more science than I did before in a way, because now it's not just this one topic that I'm super, super deep into, and it's something that only a handful of other people are as deep into across the world. Now I get to do all sorts of applications, different disease areas. It's much broader, so I feel like I'm learning actually more on a daily basis. And it's more, I see results quicker. I think what was frustrating to me is doing all these experiments for like 4 years for one paper. And then, did people really care so much about that particular finding? So I don't miss pipetting. I don't miss the failed experiments. No, I think I'm in the right spot.
Good. Did you ever feel like you lost your path during your career?
No, I don't think so. I really am a strong believer of I have no regrets in life, even if it was a bad outcome or a bad experience. I mean, sometimes you question whether you really needed to go through a certain suffering, of course. But in the end, I also wouldn't know where I would have ended up if that didn't happen to me. So I try to take something from every experience. And I also don't believe in losing your path, because we have to work for a very long time. Like, there's a lot of ways to keep innovating yourself. I maybe I won't end up doing this forever either, right? I'm probably going to try something new at some point. And isn't that what life is for? Experiment.
Here's one that I really like. What's the most unscientific belief that you hold, or maybe secretly hold? Ghosts or telepathy or something like this?
Well, I'm really big on doom scrolling on TikTok, so there's a lot of conspiracy theories that after one too many movies, maybe it's like, oh, there's something behind it. I don't know. I think there's stuff like with the moon and the stars and the planets and the things that I think there are patterns there that maybe we don't fully understand. So yeah, I think I've quite some of those.
Mm-hmm. This is an interesting one because I've asked it now a couple times, but it seems to me that it's like, it's maybe not an unscientific belief, but it just leads you to where
we haven't
explained
it
yet. Yeah, exactly.
Like same, like there are 100% there are aliens. How possible? We're really the only special ones that evolved to this stage. I mean, maybe not exactly the same as us, but I cannot believe with how large the cosmos is that there's no other life out there.
Makes sense.
Yeah, I think probability is just very low for that to be the case. I don't know.
Yeah, so it's just the things that science hasn't answered yet. Yeah.
And maybe science can't answer everything either. I don't know.
That's a good point. This was Dare to Ask. If you have a question you've always wanted to ask, leave it in the comments or ask anonymously via the link in the description. We make this podcast to highlight the lives of the people behind the science. If you've enjoyed it, leave us a like and review or share it with someone who you think would like it too. So I guess it's probably a good time to ask the question, what is your role as a business development manager? I've also seen written in some of the notes, business catalyst. What is it that you do on a day-to-day? Because again, someone who's not connected to this at all, I did research, now I do journalism. This is totally different. So what is it that a business development manager does?
Yeah, that's actually something we ask ourselves in our team all the time because it seems to be everything and it's not really a clear job description. But essentially what our goal is that we basically scout among the research that's happening at VIB for the things that could really spark something, whether that's drug development, therapeutics development, or technologies that can sustain certain processes that there is a need for. So then we go and look for what is the standard of care today? Could this be better? Who would be helped with that? Or with technologies, is there a market gap? Like companies have problems that they can't solve. Could our technology solve the issue? And would they maybe be willing to co-develop it further with us? So it's a lot of development of the internal projects. So the science, of course, is primarily fundamental at VIB. So there's quite a road still to go towards it being application ready. And that's then what we do with the other innovation and business colleagues, that we look at what are the technical improvements, what are risks embedded in the technology that we need to mitigate, what are scale-up steps, or how can we expand maybe the validation package to prove that this works in different contexts. And then we go out and try to find either a spin-off story. If we think this is sufficiently large to sustain a business model, then we go out and talk to investors to see whether they're willing to back this idea. Because again, we need outside funding to really do that. You of course need a management team and you need the people with the right expertise to build this whole spin-off story. But sometimes the faster route to patient application and impact is working with existing companies. So then we try to evaluate whether this innovation fits in the pipeline of a specific company, that they have affinity with the same topic, or they have certain expertise that when put together would actually make it more of a good idea. And then we go talk to them and we try to convince them to essentially do that together with us. In the process, we talk to key opinion leaders. That can be clinicians, it can be patient organizations, it can be other stakeholders in society. So I don't know, essentially we do all sorts of stuff just to try and make it happen. We do whatever is necessary, essentially.
Yeah, it seems like the end goal is maybe clear in that we have basic research going on here at VIB. How can we bring it into the world? But then the pathway to do that is different for every single thing. So
absolutely.
you're kind of all over the place in what you do. But it's really about connecting, the science to businesses, places where it can then reach society, reach an
Yeah.
impact. Yeah.
You're a bit of a spider in the web because you need to understand all these different stakeholders. They all have different goals. They're also often very different people in the sense of how they act in a professional environment. It's very different for a scientist versus a clinician versus an investor. So you need to understand how you can put them all together towards this common goal. So it's a lot of stakeholder management.
Yeah, people skills. Yeah, managing teams and things like this.
Yeah.
This seems like something that VIB is especially good at, or that puts a focus on that maybe other institutions don't. Is that something that you've noticed?
I think we are very fortunate in that we have a little bit more resources than what you mostly see in a university or research institute, which really allows us to have this fantastic team in innovation and business. So these are really people that impress me every day with the deep expertise that they have in specific areas, whether it's company creation or antibody development or small molecule development or technology development. And because we have this all internally, also, for example, IP management, we have our in-house IP team. So we really do have all the ingredients there to bring these projects to life. Whereas I think that's not accessible everywhere. And we also have a little bit of, investment that we can deploy if there are certain steps needed and we don't have the expertise in-house, that we can attract it elsewhere. So this model is, it's incredible, but it's also because when VIB was started so many, many years ago, it was always with this dual mission of, yes, we want to do science, but yes, we want to make sure that the investment that the people are doing through their taxes, that it brings them something back, that it flows back into society.
Yeah, that's what I was going to say, is that it feels like the resource thing is one thing, but it's really kind of a culture of this is the goal. Like we're all kind of pulling on the rope in the same direction. Is there something about, the culture here that then has been stimulated for that?
I think so, because we don't work as individuals. There's never a decision that we take that is really just one person's opinion. It's really every single case that comes to us. We do a thorough analysis from all the different aspects because we know science is not enough. Technology is not enough. The competitive landscape, finding a USP for the technology, all of that is not enough. There's other aspects to it. We need to have an IP position. Sometimes there's fantastic innovative science. We can see how it would be really impactful, but it will take millions and many, many years to get there. Then maybe that's not something that we would take on for now, because that's not something we can deliver on realistically. So it's also about, often we also say no to projects, and it's not always easy for the scientists because, of course, it's not a value of their science itself.
Right.
It's a value of whether all these other elements are in place for us with the resources and the people that we have to get it to the stage where we can partner it with someone else. Because if we can't get there, then maybe why would we start? That's just then a waste of time and resources that we can divert to another project within VIB that has a bigger chance of actually making it to the planet or to society. So it's because all these people are there, I think, we are able to execute on that.
Yeah, so one of the things you said there about the scientists maybe not understanding that when a project is declined, that it's not necessarily a judgment on their work. It kind of shows just a misunderstanding of the two worlds. You've done both. You've worked in both. What are some of the traits that you think scientists have that maybe they don't realize would be good for business, and from the other side, going back to science?
Well, science has inherent value because it's creating new knowledge, new insights, and sometimes there's multiple puzzle pieces that then together lead to something that now is applicable. So it is not a judgment on science itself if it's not applicable today, or it's not a matter of a technology not being valuable, but we have to, because scientific value is different. It's about creating knowledge. It's about publishing the paper so that it gets out there in the world, and can be used by others. And sometimes a discovery made in one area can later be applied in a different field and then lead to next steps. I think scientists do a lot of technology development to then discover more things, because technology is often the limiting factor for seeing the next bit of biological information. So that is all inherently valuable, but it doesn't always mean that there is a route or a need to apply it in a particular product, and that there's someone at the end willing to take that on and to fund that. Just last week, we had an example of a technology that was really interesting and had different applications that would be possible. And then we tried to help focus towards the applications that will likely be more valuable or more applicable than others. And I think this also helps the scientists to then divert their resources and effort towards those things if one of their goals is to valorize something.
So talking about some of the times you've had to say no to scientists about some projects, do you have a story where somebody's come in and totally convinced you of an idea and it's led to a great success story?
Absolutely. This happens all the time. I think in the end, we're in innovation and business, our goal is to innovate. So it happens more often that we're overexcited about something and then have to bring ourselves back down to reality that maybe this is super cool, but not super realistic. So I think our default is always to give something the benefit of the doubt. We always want to try. We always see all the possibilities. And that's where it's important that we work as a team, because we need to bring the realism back. Like, we are often overjoyed with new projects, and then, you're an innovator. So you're already going there. So yeah, that's why we have these set criteria, so that we're also objective in our assessments of technologies. But it happens all the time that we get excited. We have multiple, therapeutics programs, technology programs, diagnostic development. I think in the oncology center, one thing that we achieved last year, for example, is that we created a diagnostic test for women with ovarian cancer that have a certain treatment option that doesn't work for everyone. And with this test, we can select the patients that would benefit from the treatment, and we can spare that treatment from women that we know are not going to respond, so that they don't have to suffer the side effects. And that is something that until now we haven't found a business partner for. We fully developed that in-house together with the University Hospital in Leuven as our partner. And that test is now being used in the hospital itself, in the diagnostic unit. And I think last year 400 women were diagnosed with this test. So those are kind of things that we are able to achieve because we have this ability to develop things in-house. Now, of course, we would like to find also a commercial party so that we can scale it and we can bring it not just to Belgium, but also to the rest of the world.
Mm-hmm. So for scientists that are maybe early career and they're listening to this and they're maybe intrigued about this pathway, what are some of the skills maybe, or traits that scientists inherently have or they might need to have to make this transition?
Well, I think firstly, they don't necessarily have to, because that's why we are here. So I think we are that's the whole point of our team, that, as early as they have any idea, they can already come workshop that idea with us, and we try to, figure things out. What I often hate to see is people that have already devoted years into developing something with a certain application in mind. And then when we do the real, market analysis, then, we have to conclude that maybe the need isn't there. So we would like to be involved much earlier so that we can, make sure that we're on the same page and we're doing the things that are most valuable. But I think a lot of scientists, it's about, depending on what field you are in, whether that's agrotechnology or the medical field or more technology oriented, it in the end needs to have an application. So talking early on with clinicians, for example, to see, do you think this diagnostic method, do you already have a solution for that or not? If we could do this, would that help you? Would you actually change the way that you treat a patient based on the information from my assay or test? Mm-hmm. And if that is not the case, then there is no case, because it's not going to change the practice of this clinician, for example. And I think sometimes we're a bit too much in the deep technology, and we don't go out to have this broader zoom out of all the different stakeholders and just talk to them early whether is this useful or not, because that's where it starts.
Mm-hmm. So I want to ask again about your move to the US and to Harvard. What was your experience like? Was it a culture shock? Was it easy to find peer groups that you could fit in with?
I had culture shock when I moved from the Netherlands to the UK, and I had culture shock when I went from the UK to the US. The only
Might
time
have been a stepping stone.
The only time I didn't have it was actually going back to Belgium. That was much more like coming home, to be honest. I think that we don't often realize enough here that the foundation of life in Belgium, for example, is super solid. If you get sick, there will be a support system. If you lose your job, if something unexpected happens, there's a lot more care from either your employer, but also just the state in general. And that makes a fundamental difference in how free you can be in your brain and how happy you can be, not always being scared that something will go wrong. So I think it's good for people to go out there, experience different cultures and different ways of how countries are run, to maybe appreciate that a little bit more.
You're looking at the future for, let's say European, Belgian business startups coming from a science. What is it that you hope to see, and what is it that you hope that you can achieve in your career here at VIB?
I think people don't realize how good the biotech ecosystem in Belgium is. I didn't fully appreciate it before I got here either. I don't think we're very good at communicating that to the outside world. So it's really the people that are in the know, they know that. But I don't know if people outside of biotech knows how much this contributes to the Belgian economy and prosperity and stuff like that. We have a unique amount of ingredients of having excellent science and then having these many companies. There's a lot of companies from outside that also get attracted to the ecosystem here, and then it creates jobs. It's just all around quite a remarkable environment to be in. What I want to achieve particularly is I don't have a particular dream of having this drug on the market or this diagnostic on the market. I think just trying to deploy your talents where they can make a difference and accelerate that journey of getting certain innovations out there, I think is really important because we do so much science.
So at the end, we ask this one question to all of our guests, and it is, if you were to meet an omniscient being, what would you ask that being?
I think really, how can we alleviate human suffering? I think as I'm getting older, I'm getting less positive about, also the last few years, like what is happening? Like, I think we really need to get it together and turn the tide on a lot of different fronts.
Mm-hmm. That could end up being a philosophical question in itself. How do you get humans to work together? How do we do that? So I think if there's all the answers that we've heard on this show so far, that might be the one that stumps the omniscient being. I don't know. Is that too pessimistic? I don't know.
If they were out there, I think maybe they would have done something, no?
Well, you've sold me on the case for why we need this sort of pathway, this pipeline from basic research to translation, and really to do what we want to do with our science, which is improve the life, improve, the status of our planet, all of these big things. So thank you so much for taking the time. It was a pleasure speaking with you.
Thanks for having me.
If you want to hear more inspiring stories from our VIB scientists, be sure to subscribe to Called to Science. And if you enjoyed this episode, leave us a review. It really helps. Thanks for listening.